The American healthcare system is facing a crisis that is as invisible to the casual observer as it is devastating to those caught in its grip: the nationwide shortage of prescription drugs. While most public debates about healthcare focus on insurance coverage, hospital costs, or the price of new breakthrough drugs, a quieter emergency has been unfolding for more than a decade. Welcome viewers to my channel. Please subscribe, like my video and turn on notifications so you don't miss our next update. Drug shortages, once rare and temporary, are now persistent and systemic. In the first quarter of 2024 alone, there were 323 active drug shortages, according to a joint report by the American Society of Health System Pharmacists, ASHP, and the Utah Drug Information Service. This figure is more than a data point. It is the highest ever recorded, surpassing the previous peak of 320 in 2014. Each shortage represents patients who are denied access to critical medications, clinicians forced into agonizing choices, and a healthcare system stretched beyond its limits. Pharmacists and medical staff describe the situation as an emergency hiding in plain sight. Most Americans never imagine that a modern, wealthy nation could run out of life-saving drugs. Yet for doctors, nurses, and patients, shortages are no longer shocking, they are expected. All drug classes are vulnerable, said Dr. Paul Abramowitz, CEO of ASHP. His warning is sobering. No medicine is safe from shortage, whether it is a basic antibiotic or a cutting-edge cancer therapy. Particularly concerning are shortages in sterile injectable medications. These drugs are a lifeline in emergency care and surgery. They include anesthetics required for operating rooms, cardiac medications needed during resuscitation, and chemotherapy agents used in oncology wards. When these supplies dwindle, hospitals cannot simply replace them with pills from the pharmacy shelf. Many of these injectables are unique in their formulation and purpose. Manufacturing sterile injectables is also notoriously complex. Facilities must meet the strictest standards of sterility, since any contamination can endanger lives. A single failure in quality control can halt production entirely, eliminating millions of doses from circulation. With only a handful of companies producing these drugs, even small disruptions ripple into national crises. For cancer patients, the consequences of shortages are especially cruel. In 2023, the American Cancer Society warned that chemotherapy drugs had re-emerged among the most affected categories. These are not optional medications, they are the backbone of cancer treatment, often determining whether a patient lives or dies. Oncology clinics across the country report running dangerously low, or completely out, of essential chemotherapy drugs such as cisplatin and carboplatin. With supplies scarce, oncologists are forced to make heartbreaking decisions: which patients get the limited doses? Should treatment schedules be altered, even if it compromises effectiveness? In some cases, should a patient be denied treatment entirely because another patient has a better prognosis? This is medical triage of the most painful kind. Unlike battlefield medicine, where triage is about survival in the moment, rationing chemotherapy can determine long-term outcomes. Imagine a mother with young children being told her treatment must be delayed because the hospital has run out of medication. The shortage is not just a logistical problem, it is an ethical and emotional catastrophe. While cancer patients face the harshest consequences, shortages also devastate everyday life for millions managing chronic conditions. One of the most widely discussed is the shortage of ADHD medications, particularly Adderall. The shortage began in late 2022, initially due to a production delay by one manufacturer. By 2024, it had transformed into a demand-driven crisis, as prescriptions outpaced available supply. Adderall and similar drugs are not luxuries, they are lifelines for students, professionals, and families trying to manage ADHD. Without them, patients often struggle with focus, time management, and emotional regulation. Parents describe calling dozens of pharmacies, driving from city to city, or even rationing their children's medication by skipping doses on weekends so they'll have enough for school days. Adults report job losses or disciplinary actions at work when they cannot manage symptoms without treatment. The human toll extends far beyond the clinic. It disrupts education, employment, relationships, and mental health. The Food and Drug Administration (FDA) is tasked with responding to drug shortages, but its tools are limited. In theory, the FDA can intervene by expediting review processes, authorizing additional sources of raw materials, or fast-tracking approvals for new manufacturers. In practice, however, the agency is constrained by both regulatory complexity and confidentiality rules. When shortages occur, the FDA works with manufacturers to find solutions, but many details remain hidden from the public under the label of commercial confidential information. Patients and providers are left in the dark, unsure when relief will come or whether it will come at all. This secrecy fuels mistrust. To those outside the industry, it appears as though decisions affecting millions of patients are being made behind closed doors, with little accountability. Drug shortages are not new. They have plagued U.S. healthcare for over a decade, with ebbs and flows depending on manufacturing issues, regulatory changes, or global disruptions. The COVID-19 pandemic exposed just how fragile the pharmaceutical supply chain truly is. As the world went into lockdown, factories in Asia, where many drug ingredients are produced, slowed or stopped production. Transportation bottlenecks and export restrictions worsened the problem. Suddenly, even basic medications became difficult to obtain. In March 2023, the Senate Homeland Security Committee released a damning report confirming what many frontline healthcare workers already knew: shortages cause delayed treatments, reliance on inferior substitutes, or no treatment at all. The report underscored that these are not abstract inconveniences, they are direct threats to patient health and survival. Shortages don't only affect access, they also increase costs. When the first choice drug is unavailable, patients are often forced to buy alternatives that are significantly more expensive. At a House Ways and Means Committee hearing, physicians and industry experts testified about the economic burden of shortages. Families already struggling with medical expenses are hit again when insurers refuse to fully cover substitute drugs, or when pharmacies charge higher prices for scarce supplies. For uninsured patients, the impact is devastating. Some must choose between buying costly substitutes and paying for rent, food, or other essentials. In the worst cases, they forego treatment altogether. The crisis is not confined to critical hospital care. Even widely discussed medications like Zepbound and Wegovy, used for weight loss and diabetes, are now in shortage. These drugs are often portrayed in the media as lifestyle enhancers, but for many patients, they are medically necessary to manage obesity-related conditions such as diabetes, hypertension, and heart disease. Without access, patients risk relapsing into poor health, undoing years of progress and increasing their long-term risk of life-threatening complications. However, not all government proposals have been met with approval. The U.S. Department of Health and Human Services, HHS, recently floated the idea of imposing financial penalties on hospitals that fail to maintain stockpiles of critical medications. While the intention is to increase preparedness, ASHP argues this could punish smaller hospitals, especially rural facilities, that simply lack the resources to build large reserves. Much work remains to be done, Abramowitz emphasized. His point is clear: this is not a problem that can be solved with quick fixes or one-time interventions. The root causes, fragile supply chains, limited manufacturing redundancy, and lack of transparency, must be addressed at the federal and legislative level. ASHP has pledged to continue pressing Congress for new laws that prioritize patient access to essential medicines. But until these reforms are enacted, the system remains vulnerable. For now, the reality is grim. Patients are waiting longer for treatments. Oncologists are rationing life-saving chemotherapy. Families are scrambling to find ADHD medications. Hospitals are improvising with substitutes that may be less effective. And across the country, the trust in America's healthcare system is eroding. The drug shortage crisis is not a temporary hiccup, it is a systemic failure. Unless bold action is taken, the shortages of today will become the norm of tomorrow, leaving millions of patients caught in the crossfire of a